Welcome to Conversations with Colie, where we have conversations about subjects we think about but often don't speak about. My name is Nicole Miller, and I'm the author of this book series, A through Z, Guide to Raising a Good Human, a series I wrote to help in the communication process. Today, I have the pleasure of speaking with Wendy Babcock, motivational speaker and founder of Slam Networking. Hi, Wendy.
Hey, Nicole, how you doing?
Good. I have to start us out with an icebreaker, so this one's for you. If you could go back in time and live in another era, what would you choose?
Oh gosh. I think, I've thought about this before. I think I would go back to the roaring 20s. I think that would just be a
Mm,
hoot to live in. I really do.
I agree.
I
Yeah.
think the societal things would kind of suck because obviously women's rights weren't what they are now and that kind of thing. But aside from all of that, I think it would just be kind of one big party.
Yeah. And I think women were a bit naughty, just naughty
Me too.
enough.
I think they were starting to really rebel. I'm not good with my history, so I don't know. Someone's probably going to come at me, but I do feel
They
like
can come at both of us because I do believe that you're right. I think they were just starting to kind of find their voice.
yeah, I think so, and I think that would have been a fun moment to be in.
Yeah, I
Yeah.
agree. So tell us a little bit about yourself.
Oh gosh, there's a lot. So, which part of my story do you want? So, I've had lots of chapters.
Give us a brief rundown.
Okay. So, let's see. I come from childhood and domestic abuse. I worked at a hospital for 20 plus years, and in 2017, I quit my job to take on a career of motivational speaking, and just lots of different opportunities came up after that. And now I still do speaking. I've written a few books, and I had a podcast. Actually, I had two podcasts at one time. Um,
You had your own
and
show.
then yeah, yeah, the Biz Sister show that I was
Hmm.
running, and then Slam Networking. So I created Slam Networking. It's a new type of networking, and I have a journal that I sell. And yeah, that's kind of
Awesome.
everything in a nutshell.
Yep. Yep. So let's go back to when you turned 40. You
Okay.
turn 40 and you go in for your first mammogram. Tell us
Mhm.
about that.
Yeah, so I knew it was time to go in. And a little backstory, my dad's side of the family has a lot of breast cancer. So all five of his female cousins were diagnosed or had breast cancer before age 50, including my dad's sister, who was diagnosed in her 30s, and she actually passed when she was 50 from breast cancer.
Oh,
Um, so I knew, like, once I turned 40, I'm like, I'm going to be on this. I want to go in and get checked. So I went in for my first mammogram. It was obviously not fun. It wasn't terrible. I was expecting it to be painful more. I don't know. It's just, it wasn't that bad. So I went in, and then I worked at the hospital where I had my mammogram at. So they called me. I don't know if it was later that day or the next day. They called me and said, well, we want you to come back because we just found a couple spots. We just want to, it could be nothing, but we want to check. And I know that that's pretty routine because I
hmm.
did medical transcription. So I had typed so many notes saying that women had to come back and it's usually nothing. And so I wasn't too nervous about it, but
Right.
also kind of nervous just because of my dad's history. So I went back and they did another mammogram, and then they did the ultrasound. And during the ultrasound is when I started getting concerned that they were seeing something. And I'm like, because she calls the radiologist in. So it's the tech, the radiologist, and there was somebody, the nurse was in there. There was I forget who the other person was. But anyways, they're and looking and pointing, and I'm sitting there like, what the hell are they
Yeah.
looking
And
at?
if you don't see anything, nothing, you're not going to be,
Right.
yeah.
Yeah. So I'm like laying there, with, boob out, boobs out basically. And I'm like, okay, now I'm getting a little bit nervous. And I just don't know if I should ask anything or what.
Yeah.
So they get done and they tell me, okay, put your shirt back on, whatever. And the radiologist came back in to talk to me, and he's like, okay. He's like, well, we're going to send you to UW-Madison to have some biopsies. And he said, the reason why, he says, we found so many microcalcifications in both your breasts that I can't even count them all. So I'm
What
like,
I'm going to stop you right there for a second. What are microcalcifications?
I'm not 100% sure, but they're like little areas that, can show up on the ultrasound or the mammogram that can be something, or maybe they're nothing.
Mhm.
Um, he said that because there's so many and it's on both sides, He's like, the fact that I can't count them all is just a little concerning. We want to get them biopsied. I'm like, okay. A little panic sets in. I'm like, okay, that's a little bit scary, you know?
Yeah.
And so I wait for UW to call me and set up the appointment. And what really got me, this is where the panic truly set in. So the lady, and maybe they should have trained her not to say it the way she said it.
Uh-oh.
Yeah, she's like, and it's not her fault, but she's like, okay, so they have you set up for 5 biopsies, and they've never done that many before, so this is unusual. I'm like,
Ugh.
don't tell me that. Don't tell me they've never done that many biopsies on somebody in the
Maybe don't
history of
even
their.
tell you how many until you get in there and let the doctor say that, right?
Right. So I'm like, 5? What the
What the
heck, you
heck?
know?
How
So
much of my
then
boob are they gonna take? That's what I would be
right.
thinking.
So then I'm like, okay, so now I never had a biopsy before, so then I'm, like, freaking out, and I remember getting at the phone call. I was at work when I got the phone call, kinda, like, sucking it up while I was at work, got home, busted down crying. I'm like, "What the heck?" You know, this is scary.
Mhm.
And then, the day of the biopsies, I go in and the radiologist said that the team of radiologists in Madison, they all get together. This is routine for them. She goes, we got together and we discussed your case, and we feel like even though, yes, we would like to do 5 biopsies, for one, there's a couple things. It'll be very expensive even with insurance. And the pain from it, because of course, they're going to take 5 biopsies. She's like, we feel like we just want to do 1 biopsy today and then we'll proceed from there. I'm like, I'm good with that. She's like, "So we're
Okay.
just gonna do 1, we'll see what the result comes back, and then depending on what happens there, then we'll kind of figure it out." And so I said, "Okay, that sounds fair." So
So
the
now
biopsy
you're maybe a little bit relieved at this point?
a little bit, yes, just the fact that I only had to go through with 1 of them because I wasn't sure what to expect with the biopsy.
Mhm.
It's not comfortable, and you're laying on this weird raised, like, table thing. Have you ever had a biopsy done
I've
before?
never. No.
It's a weird I feel like it was a weird contraption if I'm just trying to remember it. So as you lay on your stomach on this thing with your boobs hanging down through these, like, holes in the table. It's
Oh,
so
it's
so
weird.
yeah, it's so strange, and then I forget where your hands are. They're kind of up and around the front of you. So anyways, you have to be really still, and, you feel it. I remember feeling like a burning feeling when they did the biopsy. It wasn't awful, but you could feel it obviously, and
Yeah.
it just. Yeah, it was just such a strange, and I honestly don't have that much of a memory of the whole thing, but, I remember being uncomfortable when I went home and having to use ice packs, so I was
Mhm.
really grateful they didn't do 5 at that point, because 'cause I'm like, 1's pretty uncomfortable, even with the ice pack, little bitty ice pack stuffed in my bra, walking around all day for that spot, and I think it was maybe 2 days later they call, and of course, my heart sinks like, "Okay, what's this result gonna be?" But it was benign.
Oh, good.
So I'm like, "Okay, good. Okay, all right. What do we do now?" She's like, "Well, because it was benign," she's like, I think with your family history," she's, "I would just maybe recommend that you go and have genetic testing."
Mhm.
I'm like, "Oh,
Which is
okay."
smart.
Yeah, I'm like, "Okay." And she set me up with a geneticist, and, it was right around that time when I found out that my cousin, Carrie, she's 2 years younger than me, so she was 38, um, was just diagnosed with, I believe it was, uh, I can't think of what it's called. It's like a stage 0 type of breast cancer. The
Right.
DCIS, I think it was. And she had her genetic testing done. And so she said that she was BRCA2 positive. I'm like, okay, well, I'll probably need that information.
Right.
So I went to the geneticist. They went over my whole family history, explained, kind of what the risks are, and what the elevated risk of somebody if it does come back BRCA2 or BRCA1. And they explain that everyone's got the BRCA genes. Okay, so the BRCA genes are what actually stops cancers from forming.
Oh.
Okay, so we all have I forget, I'm probably going to mess it up a little bit because I'm just going off memory, but you
Yeah.
have, I think, the BRCA1 and the BRCA2 genes in your body, and those are what actually stops cancers from forming. They're the cancer fighters.
Okay.
So when you're found to have BRCA1 or BRCA2 gene mutations, it means that they're not functioning, so they're not able to stop the cancers. So, so I went through with the testing. It's just a simple blood test, but she said it can, and this geneticist was so wonderful. Like, she sat with us for, it had to be 2 hours or longer.
Oh, wow.
Yeah, because she said, it's not a life sentence. Just even if you're diagnosed with BRCA, 1 or 2, it's not a life sentence. It doesn't mean you're going to get cancers, and it comes with it's not just breast cancer, it's, ovarian, uterine, fallopian,
Right.
skin, pancreatic, colon. There's lots of cancers associated.
Right.
It doesn't mean you're going to get it. It means you have a very much an increased risk of. So, but I had opted to get the testing because I'm one who wanted to know.
Yeah.
And it was, I think, 2 weeks. And I remember this phone call because I was sitting in the restaurant. My husband worked at the restaurant at the time. And so I was in that parking lot and in my car. And I remember getting the phone call and kind of like my stomach dropping. And somehow I don't know why I just knew it was positive.
Yeah.
Before she even opened her mouth, I'm like, it's positive. Like, I have the BRCA2 gene mutation. And for some reason that was more, I guess, devastating than thinking I had cancer, which was really odd at the time. I remember thinking, like, why am I so distraught over this? Doesn't mean I have cancer.
Right.
But I
Well,
remember
it's
just being,
scary.
it was, but the lady, there was a geneticist herself who called me herself, and she was so sweet with it. She's like, okay, well, you are positive for the BRCA2 mutation. And so she talked to me again about, options. There's watchful waiting,
Mhm.
which means that I would have had to have gone through, like, every 6 months, had a mammogram or MRI kind of alternated to kind
Mhm.
of watch to make sure nothing forms or whatever, and then of course everything, there's always screening for skin cancers and colon cancer,
Right.
that kind of thing. Um, but I had kind of already made up my mind at that point before I even knew I was positive. I'm like, I'm a very impatient person. Um, and I knew, I'm like, if I have to go through this every 6 months,
You're gonna torture yourself.
yeah, my anxiety is going to be through the roof. And knowing I
Mhm.
already had so many microcalcifications, and sure, one came back benign, which was great, but I feel like I had ticking time bombs in me, you
Right.
know. And she explained that with my family history, the BRCA mutation, that basically it was upwards of an 85% chance of developing breast cancer.
Oh, that's a pretty high chance.
It's not 50-50. That's a pretty
Yeah.
significant number. And
It's weighing to the wrong side.
yeah, and I remember there was a lady on social media who was, because I was very open about my journey on social media. I wanted other women to know, like, what I was, because I had never seen anyone who'd gone through this before, besides
Right.
my cousin. And so I wanted to kind of share my journey. And I remember a lady really criticizing me for, like, well, why would you go through this surgery and all this stuff? It's so, like, radical to do. And I'm like, so I
Not
use the
really.
analogy. I'm like, if you were going to get on a plane that had an 85% chance of falling out of the sky, would you get on that plane?
Hell no.
Right. And I'm like, it's the same thing. Like,
Yeah. Yeah, I mean, maybe that works for her, but for you, you chose because yeah, I'm
right.
like you. Every 6 months, I would be torturing myself.
Yeah. And so I said, well, I'm going to start researching and looking at what my options are as far as surgery, reconstruction, what kind of reconstruction. 'Cause I didn't even know there were options for reconstruction. I thought
Right.
you either went flat or you got implants. And,
Right.
and so in the meantime of this as well, my sister also, she had her mammogram a day after I had mine,
Oh.
so she ended up having, her mammogram was clear. She had one cyst that they saw in her. So hers was clear, but she also went for the genetic testing as well. And she also was BRCA2 positive,
Right.
so we kind of got to do the journey together a bit. And she also opted for surgery, but she opted to go flat. So
Oh.
I'm hoping someday she'll come on and share her story, because that's for her to share.
I'm hoping so too. I asked and
Yeah.
she's not ready yet. So I
Okay.
hope one day she will be.
Yeah. So we both had the same surgery. Well, not the same. We both, had the prophylactic bilateral mastectomies. Um, I joined, and this is anyone who's going through this, I joined Facebook groups
Mhm.
of women who are diagnosed with BRCA1 and BRCA2, and there was so much support on there, ideas of other women. That was like my go-to before anything else, because I didn't know, like I said, there were options other than implants. And at first I just didn't want implants because they said you'd have to go back every 10 years or something and have them, like, removed. And I
Yeah.
mean, that's fine for some people, but I'm like, it just
It's
wasn't for me.
surgery. Yeah.
Yeah. And so I just didn't want it. I don't really know why at my core. I just like, it's just, I didn't want to have implants. I mean, it's again, it's everyone's
That's a
individual
personal
choice.
preference. Right.
Right, right.
It didn't
And I
work
know
for
women,
you.
right. And I worked with a woman who had implants and, and she was fine. And, um, so there was other options. And what I learned was there was one that I was really looking at was called DEEP flap. So it's DIEP, DEEP flap. I can't tell you what that acronym stands for offhand, but um, basically they use your own tissue. So they would use your abdominal tissue. They would take off like a big flap of skin and fat and recreate breast from that. And the cool thing is because they do microvascular surgery so that they reconnect like all those vessels and things
Yeah.
so that so when you have implants, they don't stay warm or it's not your same body temperature. Like if it's really cold, I've heard women complain that they felt like their chest wall was really cold when it was cold outside.
Mm.
Um, but with this surgery, with the deep flap, it's your own tissue, and so your body temperature would be the same as the rest of your body, and
Yeah.
it's more natural feeling, I guess. They move and all that stuff like regular breasts.
Mm-hmm.
So, I'm like, well, that's what I want to have done. Um, and so when I remember talking to the plastic surgeon. He was awesome. I could not have asked for a better team of surgeons. Um, and he's like, okay, so he's like, let's talk about, implants. I can do them, over the muscle, under the muscle. And I'm like, okay, well, wait a minute. I'm like, I mean, right away they go to implants, and I'm like,
Yeah, because they think that's what everybody wants, probably. That's
right,
majority, I'm sure.
right. And so I'm like, well, okay, but I want to talk about deep flap. He's like, oh, someone did her homework. I'm like, yes, I did. He's like, okay. And what did he call it? He said it was not the Cadillac, the Lamborghini of surgeries or something.
Oh,
I'm like,
really?
yeah. I'm like, huh? He's like, well, he's like, I don't want to talk you out of it. He said, that's not what I'm doing. I'm just explaining to you that it's a much longer surgery to have done. It's a much more extensive healing process. And so he
Yeah.
walked me all through it, and he's like, of course, he's like, you're a great candidate for this surgery. He's like, I'm not going to talk you out of it. I just want you to be aware that, the surgery of 8 to 9 hours,
Mm.
that you're in surgery. And he said, then the healing process is also quite longer. He's like, but basically once you're done though, you're done. Like you don't,
Right.
unless you have to have like revisions, after that, you don't have to have anything like long term, have another surgery down the road.
Mm.
And so I'm like, okay, that's what I want. And then, and then he said, I remember the look on his face. He goes, okay, so then also, he explained the surgery, how they take this like football shaped flap off of your stomach, and I had plenty of fat. So I was
Oh,
fine.
you stop it.
No, I did. And so he's like, no, you're a good candidate. He's like, there's plenty there. And he was being nice about it. But
Yeah.
he's like, so when we remove this section, you're going to lose your belly button. So usually we'll reconstruct the belly button. And I'm like, nope, pass. He's like, what do you mean? I'm like, I don't want another belly button. He's like, and he just gave me this look of like, what? Like he
Uh,
had never heard. He's like, no one's ever said they didn't want a reconstruction. I'm like, the
But
Facebook group
really,
on,
what's a belly button for? Think about that.
right. And
Yeah.
I think what he was trying to say is like a lot of women, because you want to get us back to like your quote unquote normal self. You want to, when you look in the mirror, if something's missing that's been there your whole life, you could have kind of a reaction. And I understand what
Okay.
he was saying. Like a lot of women want to go back to as much normalcy as they can. And so I said, nope. I've read so many horror stories in my Facebook group of women who experienced infections.
Oh, so you
And
already knew you were possibly going to lose the belly button.
yeah. And
Okay.
so, yeah. And so I said, all these women, he's like, well, we can be really careful. I'm like, nope, I'm not going to wear a bikini. My husband doesn't care. I'm like, I just don't want a belly
Now, did
button.
you ask Brian? Did you be like,
Yeah.
I'm thinking about not doing a belly button. Do you care?
Yeah. No, he thought it was hilarious. He loved the idea. I think
Did he?
he's like, no, that's great. That's going to be like,
I love you more.
right. He thought it was awesome. So he's
That's
like, no,
amazing.
that's, and I got to say real quick too, is, I was definitely more fortunate than a lot of women is because Brian is a very supportive person.
Yeah.
Um, a lot of the women in my group really struggled with their mental health because their partners weren't supportive. And so like my heart went out to so many. I mean, so
How do
we
you
were,
not be supportive
I
of
know.
your wife who is
Yeah.
preventing cancer?
And not just the husbands or significant others, but the families.
Family.
So a lot of families were like, thought it was so drastic, and why would you do surgery? And it just, the
That's a
whole,
reaction that I would never have expected.
me neither. And I think it's because, my sister was going through it with me. My husband was supportive. And so when I saw all of these posts of these poor women who were just like, they're beside themselves, that they were really suffering from depression, and their mental health was severely affected because they didn't have support. And I'm like,
Mhm.
I just could not wrap my head around how people could be so cruel to somebody going through this
It
prophylactic surgery.
Yeah.
And, you know, so I felt very fortunate that Brian was as supportive as he is.
Now, in the beginning, when they first like diagnosed you and told
Mhm.
you, and you knew you were going to do all this, were you deep down at all ever concerned about Brian's reactions?
Yeah, well, of course. I mean, you know, it's body image,
Hmm.
like, even though I was having reconstruction, I'm like, okay, how is that going to affect, our sex life? Is that going
Right.
to be an issue? Is
Right.
he not going to be as attracted to, I mean, these thoughts went through my head, and he just looked at me like I was crazy. It's like, no. He's like, I'd rather have you alive,
That's
kind of
awesome.
like, so he was, but again, I think we're the exception, not the rule. And that's
Yeah.
what's heartbreaking, is because it's not the rule, and which is what it should be.
Yeah. And you're absolutely right, because you are the exception, and so is your sister.
Yeah, yeah, exactly. Because her
You
husband
both
also,
lucked out with the two husbands you have.
we really do, and that wouldn't have been the case the first time around.
Really? And you
you
know
know?
that? Yeah.
Yeah.
That sucks.
So
And that would have probably made your journey even worse because
yeah. And I think, and I can't say for sure, but I really think he would have not, I think my first husband wouldn't have supported my decision for surgery. I don't think he would have been supportive about
you
that.
think he would have made you do the every 6 months
Yeah, I think
or
I
pushed for
do.
it.
Yeah, I
Yeah.
think he would have pushed for that more. So,
When
um,
you approached Brian, he was automatically on board, or did you guys have to discuss it and you had to do your research first, or was he just automatically like, "Yes, whatever you need to do"?
yeah, he was automatically like, first thing, he's like, "You do what you need to do. I'm here, whatever, it's your body, your decision." He's like,
Go
yeah,
Brian.
yeah.
Go
I
Brian.
lucked out. Yeah,
Yeah.
he was a champion through the whole thing.
Wow.
Yeah.
Wow. I know we kind of got off topic. So
Oh,
you
sorry.
discussed with your doctor about not having a belly button
Yes.
and all that. So then what happens after that?
So what they discussed was, no, I had already had a hysterectomy when I was 29 because I had other issues,
Hmm.
and not cancer related. But because I was only 29, they had me retain one ovary so I wouldn't go into menopause at a young age. And so then we had to talk about, okay, well, we should probably remove that other ovary because of the risks again with that BRCA gene causing ovarian cancers, and having that last ovary in there, that we should probably do all this surgery kind of at one time.
Hmm.
And so we did, we talked about having the breast surgeon come in, the plastic surgeon, and the OBGYN all do their parts at the same time for the same surgery. But when it got down to it, I forget which doctor kind of put the brakes on it. He's like, because we're doing the deep flap, he's like, I feel like that's a lot of recovery to do at one time. So let's put off the having the ovary removed, because that's more of an outpatient thing. You can come in, have that removed, and you're on your way basically. I
Oh,
mean, it's
wow.
still a recovery, but it was one ovary and one tube. So it's called a salpingo oophorectomy. So that's the tube and the ovary being removed. So we only planned for the prophylactic mastectomy. And so I met with all three surgeons, and Madison's great about, I just cannot sing their praises enough at UW.
Yeah,
The way they
UW is
planned
great.
all my appointments, everything was great. All the surgeons were fantastic. So we scheduled me for that April. So this was in March, I think, when I had, or end of February, early March, when I had all my appointments, and we scheduled me for the beginning of April. So I'm kind of prepping myself, doing research on what to expect for the surgery, because like I actually watched a couple surgeries like online.
Did you really?
I did, because I was really curious about, like, what does it actually entail, and how hard of a surgery is this going to be? Am I making a mistake?
Yeah.
Um, and then of course in the group I was watching other women who had just had the surgery and what their reactions were to it. And every one of them talked about, after they had the surgery, even though they knew their body was going to look different, um, when they looked in the mirror that first time, a lot of them had these like breakdowns. because they didn't recognize themselves. And I'm
Yeah.
like, okay, I'm really going to kind of try and prep my brain to know I'm gonna look a lot different, and just be okay with it. I'm like, okay, I'm gonna go into this with an open mind. I'm gonna expect that. So I was trying to look at before and after pictures of what women look like, and thank God for women who share their journeys.
Yeah.
Because if you didn't have that, and I would have I would have felt like Frankenstein, you know,
Yeah.
be- because
So
of the
you kind of had an idea of what you were going to see.
yeah, exactly. Because some mastectomies are able to do what they call nipple sparing surgery. So basically, they can kind of remove the nipples during surgery and put them back on.
Oh, okay.
And for my surgery, they weren't able to do that. Sometimes they can say, but my surgery did end up actually being 12 hours.
Oh.
So they weren't able. So, and I kind of went in knowing they weren't going to be able to, because he even told me, he's like, we'll try to do the nipple sparing if we can, but usually with this surgery, that's, not usually possible. I'm like, okay, it's fine. So I knew what to expect. And so the day of surgery, I guess I don't want to skip over too much. Before surgery, so my surgery was in April, and I want to get to an important part before surgery because it affected my mental health a lot. So
Okay.
I talked about my cousin who was diagnosed with BRCA2 gene mutation as well. She had early stage breast cancer. So she went through with her surgery, but she went with implants, and then she had a full hysterectomy. Um, in January that year, I had been talking to her about like her experiences and how she was doing, and she just got cleared
Mm-hmm.
at the end of January, I believe it was, to go back to work, which she was really excited about. She's like, I've been kind of ready back to stuff. You're like, I feel great. I'm like, great. Well, was it the end of March? It was like a week and a half before my surgery. I get a phone call that my cousin Carrie was in the hospital. She developed some kind of a not postpartum, that's the wrong word, post-surgical infection from the hysterectomy.
Oh.
And, the next text I got was that she was septic.
Oh my
And
God.
so I was just like, what? Like she was 38 years old. And I'm like,
Yeah.
what the hell, So I'm getting, and so this particular cousin on my dad's side, like I had only actually met her once in person. So we didn't really know each other very well, but it's still like,
I don't know
I don't,
about you, but I connect sometimes with people very quickly and very
yeah,
deeply.
yeah. And
Was it
so,
kind of like that?
and it was the cousin that everyone growing up, even though I didn't meet my biological father till I was in my 20s, I'm the only blonde on my mom's side. Okay, so my blonde hair came from my dad's side. So I was supposed to look just like my aunt who passed away, and this was her daughter. And so we very much resembled each other.
Oh.
Yeah, and so I felt that connection because I'm like, this is just like the piece of my life that had been missing for all those years. Like, here it is. And I felt like I was getting close to her through these Facebook messages we were doing about her, what was going on with her and her experience, and then me being, diagnosed with BRCA2 and going through the surgery too. And sadly, she passed from that infection.
Oh my
And this,
gosh. Right
so
before your surgery on
right
top
before
of
my
it.
surgery. And I just remember like, what do I do? Like
Yeah.
there was a point where I was like, I'm going to cancel this damn surgery. Like there's no way, like this is more expensive. Like what am I doing?
Yeah.
And so I had to sit with that. And I think her service was like the Thursday or Friday before my surgery.
Oh my God, Wendy.
So it was, and so to say that like I was terrified of getting an infection is,
Yeah.
putting
That's
it
an
mildly.
understatement.
Yeah, and I don't even really know like what caused her infection or what actually happened there, but I know she was doing hot yoga like just after she was released to go to, so I'm like, if she had a slight infection and did that, like man, just
Doing too much right away, maybe.
something, yeah, I don't
Yeah.
know, but it just was such a shock. I'm like 38 years old, like that's,
Oh,
and she had a daughter and a husband that she left behind, and it was just heartbreaking,
yeah.
So then, you know, for surgery that I wasn't that like nervous to go in. I mean, I was of course nervous, but not like
Yeah.
ready to turn around and run out of the room nervous. I
Yeah.
was ready to run out of the room, run out of the room at that.
Oh.
So I'm like, okay, I'm gonna have this surgery. I know it's the right thing. I don't want to have cancer. I knew my risks. I'm like, I made the decision. I'm gonna go through with it. So of course my husband and my daughters were there. I think, yeah, Tina and Richie were there too. My sister and her husband were there at the hospital too. And we were told that it should be about an 8-hour surgery. So what happens is the breast surgeon comes in first and she removes all the tissue and whatever. And then the plastic surgeon comes in and he does his job. So he cuts basically me from hip to hip. So there's this huge incision, like with a football shape in my abdomen, and he removes all of that tissue. And then he does microvascular surgery to reconnect all of the whatever you call, all that stuff.
Holy crap.
Yeah.
That's
So it's
intense.
it is. And so interestingly, this is another little side note. So in all of my quote unquote Google research,
Yeah.
I kept finding something. There was a link to from music to healing better. And I kept finding these studies that showed that people who listened to music when they were under anesthesia during a surgery had a greater, I forget what the wording was, a greater like healing process or a better healing process, or it was quicker or something. And so I found these headphones that wouldn't, they're not Bluetooth. They're all like, there's like a little thing attached to the microphones or to the, not the microphones, the headset that you can program music into. So I had programmed like 12 hours of music and my surgeons were like, yeah, no, as long as it's not Bluetooth and whatever, you can listen to music. They had never really heard of that. But I'm like,
Really?
yeah,
Oh,
but I was
that's
like,
nice.
if there's a chance that somehow it can help, I'm going to go with it. And
Yeah.
so I went in for surgery and my daughter Caitlin told me, she's like, yeah, the first, so they can send like messages down to like this little, I don't know, even know what they had. It wasn't a phone, but where the surgeon can send messages to the family of how I'm doing. And
Yeah.
so the first message was, she's doing great. She's listening to her music. So that was kind of fun,
That's
But then it ended up being 12 hours. So I can only imagine like how nervous my family got it after 8 hours passes,
yeah.
9 hours, 10 hours, 11 hours, and I'm still in the operating room. But what happened was on the left side of my chest, when he was trying to reconnect, there's a main artery in there. They were trying to reconnect it, but they couldn't find it. And so they were like he put it as like digging around,
Oh,
so to
digging
speak. And he's like, we
around.
couldn't find it. So they had to go underneath my left armpit and in that area to reconnect that the main artery.
Mm.
And also they removed my lymph nodes that were under
Mhm.
my armpits to be safe.
Mhm.
Because the breast surgeon did say that everything that my tissue looked very abnormal that
Mm.
she pulled out. So she says she even explained that she went right down to my chest wall because she was looking at tissue that just looks very abnormal.
Oh, so
Um,
you probably would have had cancer probably within the first year.
that would be my guess. I mean,
Yeah.
the fact that even after because I do like send everything to the lab to make sure, that it's nothing, it all came back by, benign.
Yeah.
So
But that doesn't
thank
mean
God.
it's not going to turn.
Right. And even the surgeon, when she called me, a few weeks after my surgery and she told me it was benign, she's like, I'll be honest, Wendy, I'm surprised. I felt like you were absolutely going to get back and have something that come back and said that it was cancerous.
Wow.
Just because the look of that tissue was just so like
Yeah.
questionable.
Yeah.
Yeah. So recovery was hard. I lost a lot of blood. I had to go through it. I had to have a transfusion. I experienced tachycardia post-op from the anesthesia.
Now, just for people who don't know, what
Yeah.
is tachycardia?
So that's a very high heart rate. I kept setting off the alarms. My heart was beating like really, really fast.
Mm.
And part of that was because of the blood loss that I experienced. So once they gave me a blood transfusion, that kind of got it under control again. Um, so when I woke up, I had 9 drains. So yeah, that's a lot of
Holy
drains.
shit, that's a
Yeah.
lot.
Yeah. So I had 2 on each hip. I had they called it a Penrose drain off of my arm, like out of my armpits. And I don't really know the difference in the drains, but so I had 2 on each hip, and then I had 3 under my left breast, like on the armpit side, and then 2, I believe, on my right. Is that 9? That's 4, 5, 6. Yeah, that's 9. 2 on my right side. So yeah, so you got all these things hanging off of you, of course.
Wow.
And the trick is, of course, they don't get you up the first day, but when they're ready to get you up because of the abdominal surgery, you can't use your abdominal muscles, and I couldn't use my arms to sit up. Like,
Oh,
how do I sit
how
up?
do you sit up? Yeah.
You know?
Give me
So
the
basically,
remote.
right. So with the bed or like the nursing would staff would come in and like they'd have to help you, but you can't use your abdominal muscles, because you're trying to heal. So it's just
Yeah.
it was
Oh,
just
my
it was
Lord.
not fun.
Mm-mm.
But Brian again was a trooper because they were able to remove. I went home with 5 drains. They removed 4 before I left the hospital.
How long were you
Um,
in the hospital?
about a week.
About a week?
I
Okay.
think it was like 6 days. I believe it was 6 days. And so they took out the 4 drains, and so they asked Brian, they're like, "Okay, well, are you comfortable? Do you want to learn how to, empty these drains?" And I thought, there's no way he's going to do that. He's like,
Yeah.
"Sure." I'm like,
No!
I mean,
Look at him go.
right. I'm like, "Really?" He's like, "Yeah, yeah, sure." So, I mean, it's gross. I mean, it's just bloody goo
It's
that's in there. So
bloody, like
yeah, it's
mucusy,
gross.
nasty.
It's little
Wow.
bulbs that hanging down off of
Yep.
these things, and so she showed him how to like empty them and how to measure because you had to measure the liquid in there. So you want it to go down, of course, the drainage, so to get
Right.
them removed. And so she taught him how to, empty my drains and track everything. And he did it.
Dr. Babcock.
Yep. And he called, what did he say? He calls himself a surgical PA. So, yeah. So I went home and recovery was hard.
Yeah.
It was hard because I had thank God my cousin's like, get yourself a wedge pillow. Trust me, you'll love it. And so that wedge pillow was a savior because you don't want to lay flat. So you
Right.
want to kind of like up on an angle. So that wedge pillow was great, but I had so much, interestingly, of everything I had, the worst pain I had was back pain
Oh, from laying.
from laying. And they said because of being on that surgical table for 12 hours.
Yes.
Yeah,
well, that
and I'm like,
surgical table, I don't know. When they rolled you in, did you get a good look at it? Because when they did my surgery on my ankle, I said, "Is my big butt going to fit on that?" They said, "Everybody does." And then
Yep.
they strap you down.
Yep. And it's like, okay, interesting.
Are you sure my whole body's going on that?
Right. Do you have wings that come up to hold like the sides?
No, but they had that seatbelt ready.
Right. Oh,
Yeah,
God.
so I can imagine you probably had a bruise or something from laying on that thing.
It's weird because I had never experienced like back pain before. Like I've always been pretty healthy and I mean, and everything. So I've never really experienced pain. And so like I'm very sensitive to pain medication. And so they gave me like oxycodone or whatever it was.
Heavy stuff.
Yeah. And so like half a pill would make me nauseous and like,
Oh.
I felt like crap, but it wouldn't help with the pain. But I'm like, I'm stubborn. I would rather have pain than be nauseous.
Yes, I'm like
You know?
you. Yes, I don't like being nauseous. I don't like throwing up.
No,
Period.
me neither.
Yep.
And actually going into surgery, I told them that. I'm like, okay, I know the anesthesia is probably going to make me nauseous. Throw everything you have at me so I'm not nauseous.
Yeah.
What you have to do. So they gave me like 3 different medications, which was great. And I had very little nausea afterwards.
Oh, that's wonderful.
Yeah. And so I didn't take as many, like I did take some pain pills. I had to like break down and take some on certain days, but I just hated it. And it would give me nightmares at night if I took them at nighttime. So I didn't like that feeling either. But so I'm trying to think how far into it I was. So my first post-op visit, they were able to take out all the drains but one.
And
that
how
was on
far after surgery was first post-op visit?
I think it was either 4 or 6 weeks.
Mm.
I honestly don't remember. It was a few weeks though, for sure. Maybe it was 4 weeks. But basically it comes down to 2 is like, you're watching your drains. Actually, it might not have been that long now that I think of it. Maybe it was only a week or 2. I wish I would have wrote this stuff down, back when I had it, because now because that was
Yeah,
2016.
it's a blur.
It is kind of a blur, but it was a few weeks afterwards because we had to measure everything that was coming out of the drains, and when it got low enough, then you can go in and have them removed. And so they removed all the drains but one, and that was my right hip drain. That one still was kind of filling up quite a bit. So that was kind of a bummer because I was looking forward to being drain free because sleeping with those stupid things was awful.
Oh, I bet you can't
move.
move.
Yeah, and even like you don't have energy, so because of the surgery, like you're just exhausted and completely wiped. And then taking a shower with those drains sucked. You had to have like a drain belt essentially to pin all these drains to, so they're not just hanging in the shower because that's
Right.
uncomfortable.
Right.
Yeah. So yeah, it was awful. So I went home with that one drain, and I'm trying to think how long it was. I wish I would have wrote this down. I don't remember how long it was. It was maybe a couple weeks later. I thought I was getting a cold. Like I just didn't feel good. I'm like, why do I feel like crap? I just feel like, am I getting sick? I took my temperature at a slight temperature. I'm like, crap, I caught something. I feel miserable. And then I remember thinking, I'm going to go take a shower because I was due for a shower, and I'd slept a lot because it took a lot to take a shower, and I had like a little stool in there I have to sit on.
Yep.
And I got in the shower, and it would take a while to take a shower and get out. And I remember when I got out of the shower, I was like, what is this? I felt something like drip. I don't know how to explain it, from like my stomach area. And I looked down, and there was, and this is gross, so trigger warning for whoever's listening. This is kind of gross.
Yeah.
I looked down, and it's like this white, like pus material, just flowing out of the hole where the drain is.
Oh my God.
And I'm just like instant, like I start crying. I was just like instant panic because I know
Yeah.
it's an infection.
Yes.
And
And
it
now you're
clicked.
thinking of what happened to Carrie, I'll bet.
Exactly.
Yep.
So I'm like, this is why I don't feel good. This is, and it's all like just clicking. I'm like, and I can see the areas red. I knew it was kind of tender anyways. And I thought, well, it's because the drain's been in so long. That's why it's tender and that's why it's red. No, it was
Yes.
infected.
Oh gosh.
And so I first sent a picture to my sister's sister-in-law because she knows about medical stuff. And she's like, yeah, you need to call your doctor. I'm like, okay. So I call my doctor, the surgeon has me send her a picture of the wound. And she's like, yeah, you need to come in. So Brian's at work, and I have to call my husband, and I have to compose myself enough to call him because I'm just sobbing.
I
Hold on.
bet.
I was
Yeah,
just a wreck.
terrified.
And because it was just literally coming out like nonstop.
Oh my
And
God.
I'm like, what the hell? Like, that was just terrifying. So I call him, I'm bawling, and he's like panicking. He made it home in like record time. So we get to the hospital and to the surgery suite, and I didn't have the surgery, but she takes me back to one of the rooms, and she's like, okay, I have to express this. She's like, so it shouldn't hurt, but and so she has to basically like, it's so weird. It's like milk the wound, so to speak.
Right. To
And,
get the
she's like,
infection out.
I was so full of the pus that was in there. It was so gross. And so like I'm laying on this table, and she's pressing, and I can just kind of feel it just was gross.
You can feel it
And-
leaving.
And I just start crying because all I could think was of Carrie. Sorry.
No, it's
All I
okay.
could think of was my cousin, and I just thought, and I'm like, she's like, oh, I'm really sorry. Does this hurt? Like, no.
No.
So I had to try and explain to her through crying, like, I just lost my cousin before surgery. It was a post-op infection. This is my nightmare. She's like, you're gonna be okay. I promise. Like, we're gonna get you on antibiotics. It'll be fine. So she was fantastic.
Yeah.
And she was a surgical PA thing. She wasn't like the actual surgeon, but so she once again, she had to teach Brian how to express the wound. She's like,
Oh my
when she
gosh.
gets home. And so he, like I said, he was just a
He's
champ.
getting a trophy at this point. My
Right?
gosh.
No kidding, right? So then he has to like help me, and and she put me on these really strong antibiotics, and they were huge freaking monster pills, which I had to crush up and put in yogurt because I'm a big baby and I can't swallow big pills.
I can't swallow big pills either.
Right? So and obviously I lived because I'm here talking about it. So
And I love it. I'm so happy. But yes,
Yeah.
I can imagine how terrifying that
yeah.
you felt.
What's crazy is that they taught Brian how to remove that last drain for me, so I didn't have to come back in to have that drain removed. So Brian actually removed.
So he really
my
does
drain.
have a medical degree.
Right. So so they showed him how to remove that drain.
Oh wow. Wow.
So yeah, so he did, and we were both scared when he did it, but he.
That's
No problem.
that had to have bonded you guys so solidly. And can I ask, I have this in my questions, how long were you married before this happened?
2 years.
2 years.
Yeah,
So
we got married
still
in 2000.
newlyweds.
Yeah, got married in 2014 and had the surgery in 2016, and we had other family traumatic things happen in between.
Yeah.
With my niece and stuff. So like it was like we got married,
Lots
and
of things.
boom, all these like things happened around us, not necessarily to us, until I had my surgery.
Yeah, but still, it put a lot on you guys, and it
Yeah.
bonded you. It bonded
It
you. Some
did.
people it tears apart, but it bonded you
Right.
too. That's amazing.
Yeah, my daughters as well too. Like they were fantastic through the whole thing. They were at the hospital. I mean, they saw their mom in all their glory, in all my glory.
All your glory. How old were they at the time?
Okay, so 2014, Caitlin would have been, and she's my youngest one, she would have been 15 years old, and Jennifer would have been 18.
Wow.
Yeah, so they were there for the whole thing, and even like, first time I got to take a shower at the hospital, I was just buck-ass naked with my drains hanging off of me, and they were there, and nobody cared.
So speaking of buck-ass naked,
Yes.
When did you see yourself for the first time after surgery?
I caught a glimpse in the mirror at the hospital, and I still kind of had, even though I still had like wraps and things on me, so I didn't fully see it until I
Okay.
got home. So once I got home, like I had a full mirror like on my closet in my bedroom, and so that's when I had that first like, okay, let's see what I look like.
Yeah.
I had lost weight, of course. I looked much thinner because of the abdominal fat. People call it a tummy. It's not a tummy tuck, but
Right.
the result looks like a tummy tuck, because it's a lot different than a tummy tuck, the surgery itself.
Right.
Um, so it's like, okay, well that's kind of cool. I still couldn't stand up straight, so here I am, like this hunched over person because my back hurts so bad. So it's kind of, and with the surgery, like you didn't want to really stand up. I had to go through physical therapy for that,
Yeah.
but um, it was weird. I finally fully understood what those women were talking about. 'Cause I thought I was mentally prepared. I'm like, I know I'm going to look different. I know it. I've
Yes.
seen the pictures. I know what the incisions look like. I'm going to be fine. But until you're standing in front of a mirror looking at your own body that looks nothing like it did a week prior, even mentally prepared, man, I was just kind of like, it was such a weird sensation. Like it took me a very long time to kind of come to terms with that. And
Yeah.
and it's as silly as it sounds, like my surgeon, after when I went back for the follow-ups, he's like, "Do you want nipple reconstruction?" So they can kind of make
Look,
new nipples for you, and you can get tattooing and all that stuff. And at first I'm like, "No, I don't need it." But then after I was healed, you kind of feel like a Barbie doll. Like it's just,
oh yeah, I know what you mean.
because
Yeah.
your skin is all the same color, like even where like the breast tissue is,
There's no
or where the nipple
contrast to
tip.
make it look
Right,
like a breast.
right, right. Sorry.
No, you're
I was
good.
trying so it is weird how that affects like why it affected me, and like why does not having nipples affect my self-image? Like why does that even, like it really bothered me that it bothered me.
Well,
So
and because that's the normal, right?
right.
Nipples. Yep.
Yeah.
Yeah.
And then then when I was cleared, for regular activity, like, a few months later or whatever, and everything was pretty healed, and I still wasn't feeling quite normal, but I was getting back to I was back to work and all that stuff. Looking in the mirror, I didn't feel like myself anymore. I didn't feel, even though I was, thinner looking, of course. I didn't have, because I had 2 kids, so I had like the fupa or whatever they call that.
You did not have a fupa, you shush up.
No, no, I did. I had 2 kids, trust me, I did. And you have that jiggly,
Yeah, you
belly.
have that little extraness.
Right. And so like that was gone. So you think, okay, I should feel like, I feel good. I got new boobs, I got belly and tummy tuck
Look at my
looking.
stomach's flat.
Right.
Yeah.
And I didn't feel that way. I just did
Mm.
not feel attractive. I thought, and Brian, like I said, he was super supportive. Like he was fine with how I looked and everything, but I was really on the struggle bus.
Yeah.
And a friend of mine did boudoir photography, and she had a post on Facebook. It was that October, November, I forget. Anyway, it doesn't matter. I don't know why the date matters, but anyways,
Well,
um,
because you're trying to show you had your surgery in April, so now by
right,
October, November.
right. And so I had already had the second surgery. So the second surgery was early October, where I had the ovary and tube out, and I did have a few revisions because my boobs, basically, like the reconstruction. I don't know, it was like kind of going into my armpits.
Oh,
So I had like puffiness into my armpits, and I'm like, okay, I don't like that. And
yeah.
then my hips, they call them dog ears. So because of where the incision stops on your hips, and if you have pudge there or whatever, it
Right.
creates like this extra, like, I don't know. So
Like
anyways,
a little.
yeah. So they basically do like liposuction then to
Mm.
reduce that.
Oh,
So yeah, so I had that done, and then they fixed, like, and they basically did like the liposuction under my armpits to help reduce that puffiness and that, I don't know, the extra tissue that went in there. So
yeah.
anyways, so I'm recovered from all of that, and that surgery was fine. Um, but so she posts that she's looking for women with tattoos to come in and like basically get your session for free, like as like a model, like just so
Mm.
that you can show whatever. And so I'm like, I'm just gonna apply. I know her well. I'm just gonna go ahead. And so she messaged back. She's like, oh my gosh, I'd love to have you come in and do a session. And I'm like, oh, okay. And I thought to myself, I'm like, I'm not going to I feel like I'm just going to feel ugly going in to have these boudoir photos done.
Did
You
you
know,
feel at like you were gonna back out?
yeah, I did at one point. I don't think I ever told her that either. Is at one point I'm like, this is stupid. I probably shouldn't even do this. My scars are going to show. I'm just going to feel frumpy or whatever. I don't know. But she was awesome. She made me feel super comfortable, and um, so I had them done. And when they came back, I can't tell you how it helped me cry again. See myself the way my husband saw me. Sorry.
Oh.
I was able to finally like, okay, there I am. So
Oh.
some people maybe would have thought it was silly, like why do our photo, why would that make you
No.
feel more like yourself? But I'm like, I got to see myself through somebody
Beautiful.
else's lens. It was
Yeah.
like through somebody else's lens, and I got to see those photos, and I'm like, okay. And that was such a revelation for me because it had been, such a long time since I felt like myself. And for
Yeah.
whatever reason, like having that done, like just made me feel you know, like I was back in my own skin again.
Oh, that's great.
Yeah. So
That's
I know I'm gonna
great.
cry today.
No,
But
it's
it's not
okay. We can cry. Trust
Mhm.
me. I have some subjects that I
Ugh,
talk about. It happens. And what you went
right.
through, it's traumatizing. Not
It
only
is.
is it traumatizing physically, but mentally.
Yeah.
What we do to ourselves and how we feel, what
Yeah.
normal is. And then
Yeah.
to have something like this to preventative care, you go through this
Yeah.
preventative care and then you're left feeling more down and depressed, even though you prepare yourself.
Yeah, and then I did read about something about, they call us previvors because, you have the prophylactic surgery so you don't get cancer. But there's a guilt, and it's a bizarre thing. I saw some women talk about it, but they're right. There's a guilt when you run into somebody who actually experiences breast cancer and they're going through this nightmare of their chemo and radiation and they're just suffering. And there's a guilt because you were able to get ahead of it.
It's almost like survivor's guilt when,
Yeah. And
yeah,
I feel that sometimes when people are like, "Oh, I heard that like you had a mastectomy," and then to say, "Well, mine was preventative." There's just a part of me that feels guilty because I'm standing across from somebody who's going through this awful thing in their life, and I feel like somehow I cheated it. And now this poor human on the
yeah.
other side of me is like dealing with all the crap that I might have had to go through. And no one's ever made me feel that way. Like I've never had
No, it's
anyone
just
like
inside
say,
yourself. Yeah.
yeah, and you just kind of have like that survivor's guilt kind of. And
Yeah.
yeah, I didn't expect that either, but
Yeah, isn't it bizarre what our brains do to our own
yeah.
selves? Because that's really what it boils down to. It's our thoughts. It's not even
Yeah.
the other person's. And then we
Yeah.
also have social media to have the people that put that on top of what we already feel.
Right. Yeah. Oh, that's exactly it. Because and I was sharing my story. And again, unfortunately, everyone who would, besides one person who was kind of knocking me for choosing the surgeries, other than that, everybody was super supportive. And I
That's
actually
good.
had women like, this is what made me feel good. I had women who were going through like their own not mastectomies, their mammograms, who got some results back that were like, we need to have you come back in. And they're like, they didn't have anyone they felt comfortable talking to, so they would message me like, "Okay, what did you feel, like, scared even though you just had to go back in?" And so I just felt good that somebody could reach out because I did share my story, that they felt
Yes.
comfortable coming to me and saying, "Hey, I'm really scared, and I don't know who else to talk to about this."
Yes. So prior to your boudoir shots and stuff,
Mhm.
um, did you feel like around your husband you were more covering up and not
Yeah.
yourself and did it cause any kind of like any tension between the two of you?
There wasn't tension, it was more just my own, like, feeling insecure and, yeah, absolutely covering up more, um, just not feeling comfortable in my own skin, not
Yeah.
feeling attractive, not feeling sexy, that kinda stuff,
Yeah.
and so, yeah, it affected my, like, my libido and all of
Yeah.
that because I just didn't feel like I don't know how I felt, but it just didn't feel like me,
Yeah. And so
but
then you
there
get
was
those
never.
back and did it automatically fix everything once you got those pictures back and saw how Brian looks at you?
Right, it helped a lot, like, I don't know if it just I probably should have had therapy, it's probably what I needed, was I probably needed to go to therapy, But
They should maybe give people therapy automatically.
yeah, because but what's funny is until you experience it, you don't think you need it. 'Cause I thought I was prepared. I thought, nope, this isn't going to happen to me. I'm going to be fine. And then it happened. And I've been to therapy before, so I should have known myself anyways to advocate and be like, I should probably go to therapy. I'm not feeling like myself, but for whatever reason, I didn't. I don't know if I thought I was silly and I think that's it. I think as women, we think, you know, they're just boobs or whatever. Like, why am I having anxiety? Why am I having image things around this?
Yeah.
So I think we second guess ourselves, thinking like, am I being, um, what's the word for it? Like conceited because I'm worried about how I look so much.
Yeah,
You,
I can see that.
like,
And sometimes when we have those like deep-seated thoughts, I think we push them away and ignore them.
yeah. And my mom comes into play here too. So sadly, my mom's gone now, but like when I had my surgery, like even though everyone else was really supportive, she was supportive to a point. She didn't understand my reconstructive surgery. She did not understand it.
Really?
Yeah, she just thought, well, they're just boobs. Why do you need them? You don't need them they're
So
just
she
fat.
thought you should do like your sister and do
Yeah,
flat.
yeah,
Oh,
yeah. She just did not
interesting.
understand it, and I just, she kept saying things that were kind of like backhanded at me off and on throughout it, and so like I think that got to me a little bit.
Oh
You
yeah, I'm
know,
sure.
yeah, yeah. So I
So
think
that's
that,
probably where you start thinking to yourself, am I conceited? No, you have to feel
yeah.
comfortable in your own skin.
And I think that's what it was because she had me guessing, thinking like I was just, trying to be like, oh, I've got like I had a boob job or something, like
Yeah.
I think it made me feel insecure because she made me feel like, well, she didn't no one can make you feel a certain way, but
Right. No, but her
it,
comments.
right. But her comments made me feel a little bit like, am I just being too full of myself or something of how I look, you know?
Yeah, but you know what? Think about it now, saying that from that journey, but all the other
Right.
journeys that you go on in trying to be successful or trying
Yeah.
to do this or that, everyone comes at you in a way of like, oh, you think so highly of yourself. And that's
Right.
not necessarily true. That's
Right.
not true. Yeah.
Yeah, if you're not, I learned this too from all of, since my mom's passed especially, like if you're not the one in your own corner, like cheering yourself on, giving yourself pep talks, being your own rock star supporter, who else is going to?
This is a
You have to be
fact.
you have to be that person for yourself.
That is a absolute fact. I learned
Yeah.
that from you. I used to hold myself back a lot, but because of how look at your journey and you say that if I'm not championing myself, who's going to do it? It's
Yeah.
true. We can't
I used
count
to,
on everybody else.
yeah, and because nobody else is going to understand your journey like you are, so
Yeah.
you have to be, not so much, well, I mean, security is a hard thing to come by, but being secure in your own decisions and beliefs and what you want for yourself, like,
Yeah.
you know,
And
you have to
standing your ground.
yeah, you have to be that, because nobody else is going to do that for you. And if you're looking for
Yes.
outsiders to do that for you, you're going to be let down every time.
Yeah. Are you today,
Hmm.
fasting forward, are you happy with the decisions that you made with your body?
Absolutely. Looking back, I mean, I wouldn't want to go through it again, but I would absolutely make the choices I made. Even though with the whole thing and how difficult it was, I would make the same decision again.
That's awesome.
Yeah.
That's awesome. And that's all that, you can ask for. So after
Yeah.
doing all that, now you have this major health scare. Does that make you reprioritize your life?
Oh yeah, definitely. When something's making you unhappy, instead of like just sitting with it and being miserable, whatever, like I made decisions a lot quicker to get out of whatever that was, or to fix things in my life that were making me unhappy.
Mhm.
I mean, a year later is when I quit my full-time job.
And that's kind of where I was leading into. Did that health scare kind of push you to say, "Okay,
Yeah.
life's too short. I'm going to just go for it."
And I think it was a combination of things because we lost my dad in August of 2017. And then also after this surgery and kind of already having that revelation, like life is short, man. Like I wasn't necessarily happy in my job, even after all those years and stuff. It wasn't a good fit anymore for me.
Mhm.
So between that and then losing my dad, a month later is when I quit that job.
Oh, wow.
I'm like, life is I am just not happy. I'm dreading going to work. And I'm like, things need to change. I can't live
Yeah.
like that. Yeah. So
Yeah.
it definitely made a big difference.
That's awesome. That's awesome. So tell everybody where they can find you.
Oh, okay. Facebook, Wendy Babcock on Facebook. My website is wendynetworks.com. LinkedIn, I'm on Instagram, TikTok. I'm Gertie Glitterbottom on TikTok.
I love Gertie. And do
So
you
yeah.
have anything else that you want to share as far as like your health journey?
Everything's, obviously the pandemic hasn't been kind to me as well as other people with weight and stuff. I wish I would have, looking back, I wish I would pay a little bit more attention to like what I'm eating and health wise, because I think that would have played a role in healing faster too if I would have been healthier back then even. So I think, you kind of let yourself go after a while sometimes. I'm 47 now, and now I'm having another little small health scare. And so, just just putting those as a priority. We always put our health on the back burners,
Yeah,
that
that
and
is
learning,
so true.
yeah, putting
Yeah.
myself as a priority for my health is once again on the forefront in my life.
Yeah. So when you stop paying attention to yourself, that's when the health says, hey, pay
Yeah.
attention. And ladies, get those screenings because it could literally be a matter of life and death. That's what I think.
Absolutely. Yeah. Yeah, I agree. And yeah, they're uncomfortable and it can be scary, but look at the alternative.
Yeah. Yeah.
Not
I
knowing,
hope I
yeah.
can get your sister on here to talk about her decision and her
I do too.
journey. Yeah.
Yeah, and I don't want to share her story. That's for her to tell. But yeah,
Yeah,
she had a
exactly.
different experience. And I
Now, let me ask this because I think it pertains to both of you. Were your surgeries close together, or
yes.
did you do yours first and then hers right after, or were they pretty much stayed in line?
So mine was April of 2016 and hers was in June.
Oh, wow. Okay,
So they
so
were
she
pretty
had
close
you
together.
to look to a little bit.
A little bit. Her surgery was different, but also she was in a different situation because she had little ones at home where my daughters were already grown up.
Yeah.
So it was different for me than it was for her because then she had to have help come in with the kids because,
Yeah, they were
there's a lot
little.
of
Oh,
healing to do.
all right, Tina Marie, if you are listening, you need to come
Yes.
on this show and share your story.
Yeah, I think hers is a powerful story too.
It really
But she,
is. It
yeah,
is. All right,
yeah.
I'm going to stop recording. Thank you, Wendy.
Thank you.